So one of the things I like to do a lot is be heavily involved with the consults if we can. So one of the luxuries that we have is not in this office, but close proximity is my orthodontist. So often they'll let us know, hey, there's a patient over there, and if we can do a consult, one, we see the acceptance rate go through the roof, and two, I think it just creates value for our orthodontist to know exactly what's going on. So right now we're gonna go over there, and you'll kind of get a vibe of what happens during the consult with us and the orthodontist. So let's go take a look, come on. Here we go. Go back, Ritter. All right. Well, we're still post-COVID, so who knows if the masks are wear, but to be socially acceptable, I'll keep the mask on. So it's very common for me to leave my own facility and go to my orthodontist and stay on the same page. You know, we often talk about dentists quarterbacking these cases. Having a great orthodontist that's willing to kind of do what you need, get the teeth in the right spot is a huge, huge benefit. So we're gonna walk in right now and we're gonna go meet this patient, chat with the orthodontist, and make sure we can get all on the same page. Let's go check it out. So, one of the keys to a great office is to make sure the office you refer to also has a great staff, and that is a great staff. So, these are our crew here that we often talk to on a daily basis. Say hello, ladies. Don't be shy. Don't be shy. You're only going to be seen by the world. So, yeah. So we're going to go check it out. Last room, I suspect, yes?
Yes.
All right. So we're here at the office of Dr. Scott Meyer and Christian Benitez. Beautiful office. They've been here as long as we have. See a ton of patients. One of the biggest offices here in northern Palm Beach County. And we get the luxury of doing a lot of consults together. So as soon as Dr. Benitez has a moment for me, we'll be doing our consults together live. So come on in. Let's go take a look. All right. Let's come on in. So we got our Instagram crew here and the whole thing. Thanks for letting us do this.
Yeah, no problem.
Hey, how are you? So this is the crew that makes it happen. This is Dr. Meyer. This is Joe. And this is our awesome patient who's allowing us to come take a peek and see what's going on. So how's everything?
Very good.
All right. So we've got a bunch of film crew and everything like that. And thanks for letting us do this. They were just curious what we do in a given day.
Sure.
And one of the things we were talking about is how well he and I have worked together for 20 years, being able to isolate some cases and things like that. So we want to be able to show that sometimes the luxury of us being right next door to each other, coming over and chatting. And since I talked about you a lot already, thought we would just have him take a look and see kind of what's happening. So, of course, we're filming and someone's trying to reach me. Okay. That's not important. So one of the things that we did, just to kind of give you a vibe, is he came to see me, had some needs, and one of the things we're really big on is comprehensive care. Dr. Scott Meyer and myself have worked cases together for 20 years, and the reality is, you have the teeth in the right spot. I tell patients this all the time. If the teeth are in the right spot, sky's the limit. So even if they're not 100% sure what they want to do all the time, restoratively, the luxury is if he gets his teeth in the right spot, A, he can buy as much time as he wants, and then B, he can make his decisions based on him being done with his orthodontics, teeth in the right spot, and we can move forward there. Some of the needs we have here are multidisciplinary, meaning we have orthodontic needs, we have some periodontal needs, possibly maybe going with implants, and then we have restorative needs. But my biggest concern is always trying to work closely with an orthodontist, get all the teeth in the right spot, and move from there. Right?
Yep.
So, did you guys get a chance to look?
We did. Yep.
All right.
Kind of looked at it. We looked at the X-rays. Kind of looking where he's at, where he has bone support, where he's missing some teeth. Of course, we're missing number 7, some super thin bone.
Right.
In that area. We can kind of take a look at the slice here in a second. And then we've got number 11, which was moved previously into the number 10 spot, so then number 11 was actually replaced with a Pontic.
Right.
And then if we're looking at his 3D scan, we can kind of get an idea as to this is where he's at now with the occlusion.
Mm-hmm.
And we've got, again, we have a canine in a lateral spot, and then the Pontic here, he's narrow, he's got a crossbite right there on.
So what's your
19.
What's your thoughts about that canine eventually getting back to where it should be? Is that possible or not possible?
Anything's possible with time, but there's almost no bone here.
Okay.
So he'd have to go through some rather extensive ridge augmentation or something before we start to move that tooth into that area. I don't think where he is now, if we look at the X-ray, go to the Start looking
Sure.
at how much bone we have there. Pretty narrow. You know, for that
Right.
width of that canine compared to the width of bone that we have here.
Do we want to end up having him talk to periodontist first and allow him to make a decision that way, or are you just not feeling good about the movement of that tooth
I mean, it can be done. The root is very, whoever moved it, they did a nice job. It's very upright.
Yep.
So the canine root is overhead. So we're gonna have to translate it either way.
Okay.
And we kind of talked about this number 10 that's discolored. What do we do? What do we do with that? And so that's the other option is, are we gonna try to do something
right
with this?
Right.
Whereas that's, I don't know how well you can cover that up, even with the.
I was worried about the condition.
No matter how good you are, I don't know.
Hey, I'm good.
We know you're good enough. That's a tough one.
Sometimes I run out of pixie dust and I can't make the magic happen.
If that's coming out, then I don't know. Do we translate,
translate that into the central? Yep.
Or do we just leave it where it is since, his smile line, where's his smile line?
It's not very high.
Right.
It's not very high, so we're not showing gum tissue.
Right.
Not a major,
okay,
concern there. So.
Okay. So are you? I know we talked about a couple consults, both orthodontically and then the periodontist as well. Are you opposed to seeing the periodontist and us posing some of these questions with you as a whole?
I'm wondering if it's starting to get like real Taj Mahal here. Like, can I hear what we can do like right now? So far, I haven't really heard like even like the, what's at the minimum we can do this.
Okay.
To up to this point. Like,
Okay.
Can I get some of? Like,
Sure.
There's
So
four different options.
Yeah. So I have a treatment plan ready for you. So the way we run it on a restorative side, we try to make it as easy as we can for you. So basically, we've put paperwork together that says to you, regardless of what you choose to do. Yeah. Your fee with us will not change. It's a global fee. Mm-hmm. We find it easier than piecemealing it together or oops, surprise later on.
Gotcha.
So that means whether we utilize teeth, whether we use some teeth and some implants, the bottom line is once you get information from us, it will not change at all. So that's the one thing that I like to create an anchor in that regard. Okay. So then it just comes down to what are we going to do from a treatment standpoint. Right. So can we go back to his photograph? So we'll go to the photograph and I'll show you kind of what we're thinking here, because again, we can do a lot of things, but I just want to make sure if anything less than ideal, that we end up with some compromises, and I just want to make sure you're aware of those compromises if we choose to make them. And the good thing is you don't have to make an absolute decision now. One of the things we're looking at when we're analyzing teeth, even though they agree that your lip is low, in order for this to look right, there's many times where the teeth edges need to follow the lip line in order for us to have a decent smile. This is hanging very low, say, compared to over here like this. Mm-hmm. So we have this. The other problem that we have is we like to see typically an arch kind of swoop like this. So we come down here and then things start to rise up, they kind of arc down and then this. So what we've got is what we know as a reverse smile. So no matter what, even if we didn't move the teeth, let's say you declined orthodontics and we said we're just going to do something restoratively, maybe some implants if we wanted to have individual teeth, we still are left with this environment where if we don't move the teeth at all, we have a very much a reverse smile. Could things look better? 100%. Could things look as good as they would if you were my brother and I said, listen, we're just going to do this. You have no option. You got to do what I say. Right. Then by all means, we would make a huge improvement by introducing orthodontics. Mm-hmm. In fact, let's talk about the three treatments. Yep. Restorative, orthodontic needs, and periodontal needs if we're talking about the utilization of implants somewhere. Yeah. I could almost be okay with you saying, I don't want to do the extra surgery, I don't want the implants. It is ideal, but if we're going to give up something, I'd give up the implants, allow these teeth to be in the right spot, and then I could restoratively, you'd have an amazing smile, everything would be the same color, it would look great, sky's the limit, and I could be okay saying, you know what, we've moved the teeth around and we've got a couple bridges here, and that I'm okay with. If left like it is right now, we could prepare these teeth, make some major compromises here, connect the teeth back together in some bridges. We might be losing this tooth in the future just because condition. This canine is in a lateral position. One of the reasons I like working with these guys, Dr. Benitez, Dr. Meyer, is because they know how I am. Lateral teeth are shaped a certain way. There's some of the smallest ones right in the front. There are those who like to make compromises, take this huge canine and try to make it look like this. It never really works. It's close, but it never really works. You've got this huge area here because the root is so girthy. It's really meant to be in that spot. Yes, these guys could pull this tooth down. We could trim it so the gum line comes down and gets us somewhat even with this one. We could shave it along the way. Could we make it work? The answer is yes, but it has some big compromises. So as long as the patient understands that and they say, I'm willing to make those compromises, then we can make those compromises.
Right.
But we, after 20 years and working together, we like to always say, let's tell you what's perfectly ideal.
Right.
Anything you want to cut out is fine with us, but as we make concessions along the way, those all have major pros and cons, and I wanted you to know that.
Well, so if I, and I'm not against getting a periodontic consult, that's fine. I guess what I want to know is, if we do something periodontically with grafts, how long would that take, and what is the improvement over just orthodontia and then you? You know, like, so what are we
Right.
talking about with, it's going to be a delta, it's going to be, I'm going to have to go through extra surgeries or something like that. So what
Right.
is that, is it 10% better, is it 50% better, is it 100% better? Like what
If
so
you-
what would you do differently?
Well, it gives
Yeah.
you the options for implants, because without bone grafts and stuff, you know, you can't really do implants in those two areas.
Right.
Grafting here also allows him to say, okay, this area's been built up. Let's say he grafted it and it was fully grafted and it sat dormant for 6 months as that bone kind of took. Then these guys could start to say, okay, we're going to start moving this tooth back into the position where there is bone support, opening this up for it. Now, at this point, once it's open, you have a choice. Again, yes, you could drop an implant there and we make an implant normal sized tooth, or you could say, you know, I've moved this tooth here, I don't want the implant, so when you do the bridge, when I do the bridge, and maybe I go from here to here or from here to here,
Yeah.
I've now got a tooth in this spot that's anatomically correct
Yeah.
as far as the way it looks. But at that point, right now, if we leave this canine in that position, the only thing these guys can do is start to pull it down and try to trim the front and back and narrow it and pull it down and kind of start to shape it up to make it look like this, which you can absolutely do.
Yeah.
I'll say one more thing and then I'll get out of your hair. I always like to
Don't
do
get
this.
out of my hair, yeah.
Yeah, no, I think one of the greatest things is when patients come to these consults and we have to add another specialist, I think the best thing in the world is for that person to always go to the consult. Because upon being done with a consult, you get so much information, just like you're getting here, that allows you to leave as an educated consumer and go, yes, that's for me, or no, I'm not going to do that. As soon as I meet with somebody again, and they've done the consult and they have an answer, I'm super happy regardless of what it is.
Okay.
I always fear the people who sit in rooms like this, which doesn't happen too often, but every now and again they go, I don't want to do that. Yet they've made a decision with no information.
Right.
And the information we would give you isn't really fair because we don't do that part of the work.
Right.
So I could easily communicate with the periodontist, tell him what the intention, tell him what the concern is. He would be treatment planning you for two things: grafting this area, and then also giving you information for placing 2 implants in your near future, and you would have a general idea of cost in his office. You then have a general idea of cost in this office and mine, and then you could then negate what you see fit that works into your world.
Okay.
As I told you, if you just did say you did some periodontal work and you did some orthodontic work and you're like, I need a break. You can wear retainers, have a break, your teeth are in the right spot, and you can hold off on doing my work to whenever you want.
No, but your work's the fun stuff.
That is the fun stuff. Yes,
It
yes. Yes, mine is
And the quicker stuff relative to mine. So
Right,
I'm kind of bitter about the whole thing.
Right. Yeah.
18 months? 2
Right,
years?
right.
What?
Yeah, Meyer a while back came into my office. He's like, it took me 2 years to do those braces, and Mr. Big Shot, he's like, in 6.
I'll have it back in 2 weeks. How's that?
Yeah, and they're like, wow, Ramsey, you're so awesome, and I'm like, yeah. Little do you know, it's I couldn't have done it without him. So, if we could get you to the periodontist, we could get these questions asked, and then maybe we could even all meet here again.
All right.
And I think that would be the wise thing if you're okay with that. If you're okay with that, then if we can have Gutierrez speak with him.
Do we have the camera guy back too?
Yeah. Come on.
Camera guy.
So if we could get Dr. Gutierrez to consult him, and then we meet again like this, you'll be able to tell us simultaneously, guys, thank you very much, but I've opted not to go with Dr. Gutierrez. This grafting of this area doesn't sound good to me. And then he and I make the decisions on what we're going to do.
Okay.
Or you say, you know what, I am going to do that. And then we'll put the ball, to put the wheels in motion to start doing some things. I want Dr. Gutierrez to also talk to you about worst case scenario, which a worst case scenario would be the possibility that this tooth may not be with us for a long time.
That's not a worst case scenario. I'm basically already
Already
saying
kind of there.
You should pull that.
Right. So then then some funny things come up because those are clinical decisions. Because imagine this tooth is here, okay? You've got a space there and we lose this tooth. Now, one of the challenges that we have to deal with is the fact that from a cosmetic standpoint, we have to systematically plan that we're going to have 2 implants next to each other. Now, that's a whole technical world, but there are a lot of biological factors that go into that when you're going to put implants right next to each other. So these are the things that I want to have a conversation with him. So if we know we're going to lose this, we need to really talk to you after the consult, because if we say, we know we're going to lose this, and he said either yes or no, those are forks in the road, and we have to, it's a tree, a planning tree.
Gotcha.
So no to this, okay, what's that mean? We're going to lose this tooth, okay, what's that mean? But if you say, I'm going to do everything, I'm yes to everything, okay, grafting here, moving this here, no, I'm going to lose this, we've got some serious planning to do.
Yeah.
So, but the great thing is, you don't have to worry about the technical. All you want to know is, hey guys, how much and how long?
Right.
How much money? How much time? And then we
where
can,
do I begin?
and where do we start? And I'll map all that out for you.
Okay.
But I think the fair way to do it would be, do that consult. Joan will call you. We'll meet just like this, same room, same discussion, and say, okay, what's your thoughts? And you're going to tell me it that
All
day.
right, I've come this far. I might as well.
Yeah. You know, and the greatest thing in the world is you're going to be done, and you'll be able to say, okay, listen, I did it, and I either want it or I don't,
Right.
and then we're all on the same page about compromise or not compromise or whatever the case may be.
Okay.
So, all right, cool. Does that help a little bit?
Yeah, that's cool. That's
All
cool.
right.
I'm actually
Would
gonna
you
show
help
one of the
him?
cases that
Yeah,
you
that'd be
have.
great. Yeah. Oh, yeah, that'd be great. So if you could help him
Absolutely.
situate with
And
Dr.
Dr. Gutierrez.
Dr.
I'll give him a
Gutierrez.
call for you if
Okay.
you'd
All right.
like.
I'm gonna do
Where's
one
he
more.
located?
I'm gonna do
Sorry?
one more
Where's he
thing.
I believe is he in West Palm? No.
He's in West Palm.
He
Yeah.
is in West Palm.
Yeah. So I'm gonna do one more thing.
Yeah.
I communicate with my specialists this way. I don't make phone calls because they're never free. I'm never free.
Yeah.
So I'm gonna do what I always do, which is a video referral. So I'm just gonna
Okay.
do it real quickly, and then he'll get this. So by the time he meets you, he could access this video a million times if he wanted. So if that's all right.
Gonna look
So
at
here we
them.
go.
I'm going to show you some of what he's doing.
Dr. Gutierrez, this is Dr. Ramsey, this is Matthew. We're currently in the office of Dr. Meyer, which is next door to us. I wanted you to meet him because we're going to be setting up a consult with him. We've got a lot going on here. Right off the bat, from my world, you can see we've got a reverse smile here. Currently a 3-unit bridge in this area, and a bridge over in this area replacing number 11, because when he was younger, his 11 was put into the 10 spot. We've also got a possibility of a failing number 9. So after a CT scan was done here at Dr. Meyer's office, it's determined that we've got some root angulation things that need to be cleaned up if we're considering implants in the future, but also we've got a defect here and some bone grafting. So Matthew knows that his future is restorative, orthodontic, and periodontal. What I want Matthew to be able to do is be able to pick and choose what's going to work into his life, and the only way to do that, honestly, is to have a consult with you so he has all the information and can make the best choices for himself. So we are going to ask you to consult him for the scenario of grafting this area. Once it's grafted, we can then start to bodily move 11 back into the position it should be. We'd then be planning for the fact that there will be no number 10, so we'd have an implant in 10, the loss of number 9, implant in 9, and the implant in the area of number 7. Obviously, it should Matthew commit, we would have different sections of temporaries as the case is going on, and I'll manage all of that. But really, Matthew just needs to know time elements of grafting and healing before things can be moved, and then ultimately, what are we looking at if he ends up with a few implants. So if there's any questions or concerns, let me know. We're going to call your office now, and we will get Matthew over there for a consult. Once he's done with the consult, then Dr. Meyer and myself will be meeting again to go over what his thoughts are regarding your information and creating a decision tree to move forward with his case. Any concerns or problems, please give me a call. Thank you. Okay, I'm going to take this video. I'm going to send it to Meyer and Benitez, myself, and Dr. Gutierrez.
Okay.
And we all have it. This way he's fully aware of what's going on. As soon as you can call and make a consult appointment, that would be awesome.
Okay.
And then we'll meet again as soon as you
I
want.
appreciate all your time.
Yeah, no, happy to do it. Happy to do it. All right,
All right.
good to see you. I'll see you back in this room as soon as we do the consult with those guys.
Okay. Great.
Okay.
Thank you.
All right, you got it. Any problems in the interim, please, if you need anything in the interim, let me know.
Okay.
Okay, thanks.
Thank you.
Thanks, Jody. Thanks for letting us
Yeah, no
hang out with
problem.
you. All right, cool. I'm sending you a reference video as I always do. Okay.
What were you going to ask?
Sounds good. Meyer, Benitez, whoa,
Oh, no, that was...
you guys, Gutierrez,
No, that's a bridge on the top. That was the top.
me. Yeah,
I know,
so,
right.
all right, thanks for letting the Instagram guys come.
good.
All right, thanks. All right, head back to my office. All right, see ya.
Bye now.
See you guys.
So what you just saw is a typical consult. We try to give the patient as much information as we can. One of the big things I'm big on is I really don't want my patients to make decisions without having tons of information. I don't think it's fair to them. It's not fair to us. It's not fair to anybody. Can't make a decision if you haven't done the consults and collected the information. One of the things I'm big on, as I told him, is once he has all the information, then all his decisions are educated, and I love that. So whether he says yes or no, he's been able to make those decisions on the confines of some education. So based on that, consult's over. I got to get back to work. Thanks for hanging out with us. That was a consult day, a big day, and if he chooses everything, he's going to end up with a beautiful smile. So take care, guys. See ya.